Module Overview. Electronic health records, EHRs, have revolutionized healthcare delivery by digitizing patient information, enabling real-time access, remote monitoring, clinical decision support, and improved patient outcomes. However, the digital transformation of health data also introduces complex challenges around privacy, security, access control, and legal compliance. This module provides a comprehensive and granular understanding of how HIPAA regulations, especially the privacy rule and security rule, interact with EHR systems to ensure that protected health information, PHI, remains secure, portable, interoperable, and accessible only to authorized individuals. The module is designed to equip you with practical knowledge and compliance frameworks aligned with accreditation standards, regulatory obligations, and emerging health IT innovations. Module Content 1: Understanding Electronic Health Records, EHRs. An electronic health record, EHR, is a digital version of a patient's paper chart. EHRs are real-time, patient-centered records that make information available instantly and securely to authorized users. Unlike EMRs, electronic medical records, which are used within one practice, EHRs are designed to share information across providers and settings. EHRs include medical histories, lab test results, medication lists, imaging reports, diagnoses and treatment plans, immunization records, allergies, progress notes. These systems are governed under HIPAA to ensure that data remains private, secure, and only accessible on a need-to-know basis. 2. HIPAA Privacy Rule and EHR Systems. The Privacy Rule sets limits on how PHI, including EHR data, can be used or disclosed. Core principles include minimum necessary standard, only the least amount of PHI should be disclosed for any given task. Patient rights. Patients have the right to access, request corrections to, and obtain copies of their EHRs. Authorization requirements. Patients must provide written consent before their EHR data is shared with third parties for non-treatment purposes. Notice of Privacy Practices, NPP. Organizations must inform patients how their EHR data is used and disclosed. Failing to comply with these principles, even within sophisticated EHR platforms, can lead to HIPAA violations. 3. HIPAA Security Rule and EHR Systems. The security rule provides detailed requirements to protect ePHI stored or transmitted through EHR systems. Key components include access controls. Only authorized individuals may access or edit patient records. Audit controls. Systems must log who accessed or modified EHRs and when. Transmission security. Use of encryption protocols, e.g. TLS SSL, to protect data in transit. Integrity controls. Ensuring that patient data is not improperly altered or destroyed. Automatic log-off and session timeouts for idle terminals. Device and media controls for backup, reuse, or disposal of data storing devices. Organizations are expected to conduct regular risk assessments to identify vulnerabilities in their EHR systems and correct them. 4. Interoperability and data portability under HIPAA. Interoperability refers to the ability of EHR systems to exchange, interpret, and use health data across different networks or software platforms. HIPAA supports data portability and exchange, provided the receiving party is authorized under HIPAA, the transmission is secure and encrypted, the data shared adheres to minimum necessary standards, patient consent is obtained where applicable. With the rise of health information exchanges, HIEs, FHIR, fast healthcare interoperability resources, and API-based access, interoperability is becoming more common and increasingly complex. 5. Patient rights in the age of EHRs. Patients have growing expectations around digital access. HIPAA guarantees right to access. Patients must be able to view or receive copies of their EHRs within 30 days of request. Right to amend. Errors or omissions in EHRs must be corrected upon legitimate patient request. Right to restrict. Patients may request restrictions on disclosures of their data, e.g., sensitive diagnoses. Right to confidential communications. Patients may request data be sent to an alternative location or in a specific format, e.g., via email. EHR systems must be designed to support these rights technologically and procedurally. 6. Whistleblowers and complaint rights employees and patients can file HIPAA complaints without fear of retaliation under federal whistleblower protections. OCR investigates. Retaliation claims allegations of ignored breaches, unsafe data practices. Organizations are encouraged to have anonymous internal reporting systems to address issues before they escalate externally. 7. Risk, mitigation, and proactive compliance strategies. To avoid HIPAA violations and penalties, healthcare organizations should conduct annual HIPAA risk assessments, implement a HIPAA compliance program with designated officers, maintain compliance documentation and training logs, implement technical safeguards, access control, audit logs, encryption, enforce incident response and breach reporting policies, stay up to date with HHS guidance and legal updates, global accreditation alignment, standard, HIPAA enforcement, integration, CPD, CEU, CME standards, compliance training, audit preparedness, staff competency, ISO 27001, internal audit processes, risk management, breach response, NIST SP 866 OCR audit preparation, control implementation, GDPR, EU, data breach fines, accountability principles, enforcement protocols,